Health is an essential component of human being. The physical, mental, and emotional well-being of a people helps them live and maintain optimal lives. It is for this obvious reason that governments that mean well for its teeming population initiate programs and policies that seek to promote healthy living. The consequence of having unhealthy people or population extends beyond the personal challenge ill health poses to families and communities, as the vibrancy of any economy cannot be totally divorced from the well-being of the people or the entire nation. In fact, it is widely believed that the greatest natural resource a society has is its people, and its success depends on how they are nurtured and cared for.
Access to health care has always been a problem all over the world. That is why people are going for universal health coverage where everybody will have access. When the people come to the hospital and they have to pay out of pocket, then they will not want to access health care. They rather go to the quacks, go to the chemist and all that.
You will agree with me that health is wealth, and it is very key. You only lead those that are alive. You cannot lead the dead. And of course, if you must succeed as a government, you must ensure that the health of the people are well.
In Delta State, South Nigeria, the main thrust of the administration of Senator Dr. Arthur Ifeanyi, Governor of Delta State, in the health sector is how to reach out to the unreached. This policy direction has triggered a special focus on the poor and vulnerable, even in remote communities in the creeks of Delta. The Okowa-led administration embarked on the massive repositioning of existing healthcare facilities in the state.
We can actually say that authoritatively because we know that he has actually made sure that the health insurance scheme actually runs in the rural communities too.
Aside the huge resources deployed to revamp, rebuild, renovate, upgrade and equip health facilities across the 3 senatorial districts in Delta State, what has become the defining philosophy of the Okowa administration in the health sector is the introduction of the Contributory Health Insurance Scheme.
In just a year plus, we have enrollees well over 300,000, and these enrollees are actually made up of pregnant women and children under 5 years of age, for which the state government pays the premium of such people. And we have also begun to enroll widows, and the premium of the widows is actually paid by the state government.
There can't be a better program than this. This is the first time we are having an amount as 9 million naira open to the hospital, which have now budgeted to Asaba to allow us use to tie this whole place. Brand new generator now, 60 kVA, that's been brought now is from that money. It has never happened. We are very glad, very happy. I'm not a politician, but this is what I have seen. He had done too well. In short, I will tell everybody they should vote him for second tenure. So I will continue with this program.
Governor Okowa's quest to evolve a paradigm shift in healthcare delivery was quite manifest even in the early days of the administration. Shortly after the State Assembly was inaugurated in June 2015, the Contributory Health Insurance Bill was amongst the first 5 bills sent to the lawmakers. The bill, which has since been signed into law, paved way for the establishment of a commission to administer the new health program.
Immediately he resumed office. That was the first bill he brought to the House. And that scheme is tailored towards providing qualitative healthcare delivery to all citizens of Delta State, irrespective of your color, your financial background, where you come from, and to God be the glory, that scheme has revolutionized healthcare delivery in Delta State.
In order to progress along the line of defined objectives as enshrined in the law, management of the Commission conducted a baseline assessment survey to determine key household demography, current health expenditure and availability of healthcare facilities. The assessment was followed by advocacy meetings with healthcare providers.
We practically sell the commission to the general public. We let them know what we are doing here, what they stand to benefit by enrolling into the scheme, hospitals that are accredited to give them the services that we have, and we receive complaints from them where they are not satisfied with the services rendered to them. When they actually send their claims, we also ensure that they are paid on time.
The commission commenced the scheme in 2017 in 62 secondary government healthcare facilities by enrolling persons covered by the state government's free maternal and free under 5 healthcare program. The state government undertook the burden of paying the health insurance premium of children under 5 years and pregnant women.
The Contributory Health Scheme is a beautiful scheme that brings healthcare services to the doorstep of every Deltan. Presently, every pregnant woman and all who are under 5 are enrolled free under the scheme. 20 widows per ward across the state are accessing healthcare under the scheme.
For the first time when I came here to register, I didn't pay for anything. Both the drug that they give to us is free. Thank you, Governor Okowa, as you create this great program for us. We are grateful. God will bless you.
Starting from the very first day I started Mantinental here, everything was made free, the tests, the run, and the rest of them. And I thank the government of Okowa for making it possible for we, the pregnant women, to have access.
Today, no fewer than 255 public primary and secondary healthcare facilities have been accredited to handle the healthcare needs of enrollees. Enrollees of the health insurance are saved the trauma associated with out-of-pocket expenses for urgent Medicare.
One unique feature about the Delta State Contributory Health Scheme is, beyond taking care of those in the equity, formal and informal sector, the state government has taken up the responsibility of footing the bills of vulnerable persons in the society. In just 2 years, no fewer than 300,000 persons have enrolled, and this is only a testimony that many have embraced it.
Senator Dr. Ifeanyi Okowa is supposed to be given an award for this wonderful scheme he has introduced to the state. I have benefited a lot. They have given me a card from the hospital that any time that I come, even with my families, that I should present it with my ID card. They will attend to me freely. I'm so surprised.
I will give a kudos to the governor for ever thinking of this, because like the other time my colleague's son was admitted, if it were to be before, I know how much she would pay, but she didn't pay any money.
I don't have any money with me now, but because of this Delta Health Insurance, I can come here, they will treat my children, they will attend to me, then I will go home. I'm very, very happy for this thing that they are doing. Okowa is going back come 2019.
The government has also extended this gesture to about 5,500 widows across the 25 local government areas of the state, thus making it possible for them to access Medicare without the associated stress of sourcing for immediate cash to settle medical bills.
The plug I like her. Anything when you do me now, I go work, I go there, I'll give them this card. They go treat me and my body go dey fine. God go bless her. If you come for second time again, go help her. Because since we get governor, never get kind governor when they take care of widow. Same if we sick, we go help her and he go pay us money every month.
When I see him, I salute, I go salute him. Tell her say God go bless him. And only God I go really bless him. Not be waiting I go do for him.
I believe the government has done everything possible. You know, in a society like this, there must be some bad elements that want to bring down the effort of the government. I believe the government should also put in a monitoring team to checkmate every angle so that to make the smooth running of all those drugs and make the nurses be on their toes in order to give this medical treatment free for the citizen.
Aware of other challenges associated with growth, Dr. Ben Nkechika and the chairman of the State Contributory Health Insurance Commission are not leaving anything to chance. Rather, they have put machineries on ground for routine inspection, monitoring, and periodic evaluation of the scheme to ensure sustainability, transparency, and accountability.
Bring them case file. CMD should not sit in the office all the time. It should go around the hospital. So that monitoring and follow-up is very important. But that's the only time you see all these little issues.
The commission conducts these inspections regularly. We don't give pre-information so that there will be no pre-planned responses to questions we will ask.
If there is complaint, the liaison officers immediately alert the system here. We have call centers that is 24 hours running. So if you go for service and you didn't get it on time, you just call director or the person in charge will take action immediately. And then we are holding meetings and discuss on how best to care for patients and make sure that they are satisfied.
The desire to cut down the cost of running the program and serve the people better has brought about the engagement of partners. For instance, the Commission signed an MOU with Servier Pharmaceuticals of France for its hospital cash cover program and also trained 2,000 medical service delivery personnel. The Commission has also gone into a partnership with the Bank of Industry to revitalize 25 defunct healthcare facilities.
To be able to fund it, you need to have collaborate with the private sector to run it, because government can run most of those facilities. And then we'll begin to have some relationship with Bank of Industry to get some soft loans with pharmacists that are collaborating to see how some private sector will be given some level of loans. But doing that to enable individuals, private sector people, man most of those centers in those areas and provide those facilities.
The scheme has been nationally acclaimed to have made a success. Recently, the program earned the Okowa-led administration and national recognition as Delta received awards for the Outstanding State Government Healthcare Program of the Year 2017 and the state with the most people covered under its state social health insurance scheme.
Welcome to Delta, my Delta, my Delta. Welcome to Delta. Delta, my Delta. Come live in Delta. Come invest in Delta. Come explore the potentials of our state. You better run, come to Delta State. Come and see the good things where Okowa they do. You better run, come to Delta State. Come and see the good things where Okowa they do. I see your job and wealth creation in Delta. Make the youth say them highlight Okowa.
Today, the State's Contributory Health Commission has carved a niche for itself. The quest by our smart Delta media team to understand what has earned the Commission such national awards and commendation led us to have a chat with the Director General of the Commission, Dr. Ben Nkechika.
The important thing is that the relevant health and education policy, that is from where we derive the health for all Deltans towards achieving universal health coverage, is being put into action in terms of the fact that they signed a bill that became a law to ensure a mandatory health scheme. He set up a board, he set up the processes, he approved all that, and the scheme is functional. In fact, he's our #1 advocate for health insurance in Nigeria because of his knowledge. At every event he talks about it, and when the chief executive of the state is talking about a program as a chief advocate, I mean, it's a good incentive for the scheme to grow.
The scheme's core mandate and objectives are to ensure that every Deltan has access to good health care services, protect families from the financial hardship of huge medical bills, limit the rise in the cost of healthcare services, ensure equitable distribution of healthcare costs among different income groups, ensure high standard of healthcare delivery to Deltans, and ensure efficiency in healthcare services.
Our core mandate is to implement all activities geared towards ensuring that all residents of Delta, irrespective of background, tribe, as long as you live within the boundaries of the state, you are enrolled on the scheme.
Universal health coverage is central to the attainment of the Goal 3 of the United Nations Sustainable Development Goals (SDGs), which includes the provision of access to quality health services while protecting citizens from financial impoverishment due to cost of ill health when they need it.
SDGs, if you align it with the SMART agenda of the present administration, it's like His Excellency the Governor saw the future to touch the lives of Deltans.
The commission is structured to accommodate expansion and growth as such efforts are on to tackle encumbrances and transits from manual and paper documentation to easy internet self-service procedures. With the establishment of a registration center at the head office on DBS Road, Asaba, and at each of the 25 Delta State Contributory Health Commission liaison offices in the 25 local government areas, in addition to a 24-hour call center to ensure enrollees all-round satisfaction.
Please, you have to send me the patient's name, the patient's unique identity number, and the diagnosis. Then if you're referring the person out of your hospital and the hospital you're referring the person to will reply you immediately.
The moment you enter the contact number, you direct at TMP. Once you enter to TMP, then you feed us information. If you have 4 children, biological children, your husband, then we continue the process. When that is done, you will assign a facility that is the hospital of choice by the primary enrollee. Then once you are completed, we go in for your card, which will be captured in another section for card printing. That's it. After 3 weeks of the registration, your name will be forwarded to the hospital of choice.
As enshrined in the laws of the state, the scheme is made mandatory and its processes, programs and policies are structured to succeed. Specific responsibilities are expected from the key players of the scheme, and they must play by the rules in providing the services agreed with the Commission to ensure enrollees' satisfaction.
When the hospital staff flouts the provisions of the law or the operational guideline or the clauses of the agreement, we issue them with warning and go to the extent of asking them to refund any monies that are paid by enrollees.
Smart Delta.
Not only did the Smart Delta media team visit health facilities in the state capital, we also traveled around the 3 senatorial districts to ascertain the people's reaction and market acceptability of the scheme.
It's a nice scheme, and for me, I will try to register because the scheme will help my family, even including myself.
When I reach the place I live, I will tell my friends the good news to them.
Stories of people postponing care until they are severely or dangerously ill, stories of misdiagnosis, of incomplete treatment, of the struggles to navigate a complex system and out-of-pocket payment for healthcare services are some of the challenges the Delta State Health Contributory Scheme is set up to address.
If you call before, they'll call right only 1 draws for me. The rest one, they will tell you, say, go buy and not get there. As I call yesterday, I even surprised, say everything. Why would I say I want to admit my because I say, God, I'm not getting money when I want to pay for anything or any injection. As I call, they give me everything free. I am surprised. I feel happy, truth. I feel if you say God may go feel be like do like this, for us, happy.
Sicknesses that takes people's life is just because of money. Even in some of the hospital I was, when you treat some people, they will run away with the bill, and for them to come to hospital again becomes a problem. And because of that, just little sickness will take their life. All my drugs are given to me. All of them are given to me free.
It was a pleasant surprise that some of the formal sector enrollees were very excited about the program and are even much knowledgeable of their rights as enrollees.
Since the program started, she delivered here freely. And then after 1 year, the church just fell yesterday and we are here. They've admitted the child now. Generally, everything they're giving to us free. The government should continue. And with this now, I think 2019, we hope to return Okowa. so that I can continue this good work, because the second baby is coming, so I will have free delivering care at that time too.
Okowa is trying for children mostly. I not see my child, everything free, medical thing free. Even when I'm pregnant and everything's free and successful. Okowa, God will bless Okowa well for me.
The health facility tour by the Smart Delta media team also provided an opportunity for more residents of Delta and Deltans who were uninformed about the scheme to eagerly request for procedures on how to enroll.
As a civil servant, we saw it in our pay slip, the deductions, and I decided to come to process it. This is health affair. It will be beneficial to anyone that actually go into it.
It's a nice program, so I decided to carry my children today. It's not easy. Give us at least free health. I try for that one. I take forward to thank you for the program.
The Chief Medical Director, Ole Central Hospital, Dr. Bright Inauho, said the scheme has enabled them provide services that endeared as much as 2,000 enrollees to their facility, adding that because the enrollee is king, his doors are always wide open to attend to enrollees' complaints regarding the provision of health care.
For every enrollee that comes here, I think it's a smooth sail because we've sensitized from the records to the doctors, to the pharmacy and lab. So once they know that it's a contributory health scheme, they know that, okay, this patient is not supposed to pay anything, and then they get treatment swiftly.
A lot of times some enrollees complain of not having drugs being given to them that are prescribed by the doctors. Why this challenge?
If the pharmacy is telling an enrollee, for example, that this drug is not available, you come and see the management, and so we'll make an arrangement for that enrollee to get that drug. It would not be nice for them to go and now pay for drug outside when we can make the arrangement for them to get such drugs here.
The women's ward had lots of women cuddling their new babies, while expectant mothers were confident and not worried about their medical bills since the scheme had taken care of them. Some of them told us their stories.
They are taking care of us and I didn't pay any amount of money.
Since the day one I'm coming to this hospital for checkup, I'm not paying for drugs, I'm not paying for anything, even test, nothing. So I'm thanking the government for what I've done for we women.
I want to say we are grateful to Delta State government for assisting most of our women that were not able to give birth in the hospital due to financial constraint. But since this free maternal and under 5 came into view, we have been having positive results.
To ensure qualitative, effective and accessible healthcare services, the premium amount for the scheme has been considered to suit the benefit package, making it affordable to accommodate a good part of the state disease burden. A premium of 7,000 naira per enrollee is stipulated for the informal sector groups, while 1.7% of gross salary for the formal sector groups with the employer contribution also on behalf of each employee.
This scheme is very important to the workers because they can have emergency at home, so due to that they have money to pay anything, but with this program they can be comfortable and very happy to take their family to the hospital with free access and everything. So I thank Governor Kowa for doing this good job.
Despite the initial challenges associated with new initiatives, it is heartwarming that the scheme is able to surmount them and is succeeding, while new challenges of more workforce is receiving adequate attention by the Commission.
The number of patients are high and we need enough hands, and because of that we are looking into the NYC schemes for assistance, empowers personnel, they should be deployed to us, and also on our own we have also applied to the management board to allow us to be able to have hired workers that we can pay out of our capitation.
Most distinguished Senator Dr. Arthur Ifanyo-Kowa is not unmindful of the cooperation and support of Deltans in the delivery of democratic dividends, but With the well-being of Deltans being his focus, he is poised to do more. Senator Dr. Arthur Ifeanyi is desirous of healthy state where there is health for all Deltans.
Come to Delta State, come and see the good things where Okowa they do. You better run, come to Delta State, come and see the good things where Okowa they do. I see your job and work creation in Delta, make the youth say them higher. Okowa, I see good roads everywhere in Delta, make the people say them cola. Come live in Delta, say me I say, come invest in Delta. Come explore the potentials of our state.